Today, we're tackling an incredibly important topic: pancreatic cancer. This type of cancer can be very challenging to detect early, which makes it very important to be aware of even the less obvious symptoms. In the next few minutes, we're going to go over 5 unusual but significant signs of pancreatic cancer that you should pay attention to. These signs might seem odd, but understanding them could be vital for early detection and treatment. So let's dive right in. Pancreatic cancer is often referred to as a silent disease because its symptoms can be subtle and might not become noticeable until the cancer is advanced. According to the American Cancer Society, being aware of these signs can help in catching the disease early, which is important for better treatment outcomes. Let's explore these 5 odd signs that could indicate pancreatic cancer. First on our list is persistent abdominal pain. Many of us experience stomach aches from time to time, but there's a difference between occasional discomfort and persistent pain. Pancreatic cancer often causes a persistent dull ache or discomfort in the upper abdomen. This pain can sometimes radiate to your back, and it might feel different from the usual types of stomach pain. If the pain doesn't go away and doesn't respond to common treatments like over-the-counter medications or changes in diet, it's worth taking seriously. This kind of persistent abdominal pain can sometimes be mistaken for less serious conditions, like indigestion or gastritis. However, if the pain persists and worsens over time, it's a good idea to consult with your healthcare provider. Persistent abdominal pain, especially when it's new or different from what you're used to, could be a sign that something more serious is going on. Next up is unexpected weight loss. Losing weight without making any changes to your diet or exercise routine can be quite alarming. When this weight loss happens rapidly and without any apparent reason, it could be a sign of pancreatic cancer. The cancer might be affecting your appetite or your body's ability to absorb nutrients properly. If you find yourself dropping weight quickly, even though you haven't changed anything about your eating habits or physical activity, it's important to take note. Rapid, unexplained weight loss can be a red flag for various health conditions, including pancreatic cancer. If you notice this happening to you, especially along with other symptoms, it's a good idea to see a healthcare professional. They can help to determine the cause and whether it might be related to cancer or another condition. Another significant sign to be aware of is jaundice. Jaundice is characterized by a yellowing of the skin and the whites of your eyes. This happens when there's a buildup of bilirubin in your blood, often due to a blockage in the bile duct caused by the cancer. Along with the yellowing of your skin and eyes, you might also notice that your urine becomes darker and your stools are paler than usual. Jaundice can be caused by several different issues, but when it appears suddenly or is accompanied by other symptoms like abdominal pain or itching, it's particularly concerning. If you notice any of these signs, it's important to seek medical advice as soon as possible. Early detection of the cause of jaundice can lead to more effective treatment, so don't delay in getting checked out. Did you know that new-onset diabetes in adults can sometimes be a sign of pancreatic cancer too? If you've recently been diagnosed with diabetes, or are having trouble managing your blood sugar levels, it could be related to pancreatic issues. The pancreas plays a key role in producing insulin, and when it's affected by cancer, it can disrupt your body's ability to regulate blood sugar. If you've been diagnosed with diabetes later in life, or if your diabetes management suddenly becomes more difficult, it's worth discussing with your doctor. New onset diabetes, especially if it comes with other symptoms like abdominal pain or weight loss, should be investigated further. Your doctor might recommend tests to determine if there's an underlying issue with your pancreas that needs to be addressed. And lastly, let's talk about fatigue and weakness. Feeling constantly tired and weak, even when you're getting enough rest, can be a sign of pancreatic cancer. This kind of fatigue can interfere with your daily life and make it hard to perform your usual activities. Fatigue is a common symptom of many different health issues, but when it's persistent and not explained by factors like stress or lack of sleep, it's worth taking seriously. If you are experiencing unusual or severe fatigue, especially when it's accompanied by other symptoms, it's a good idea to consult with your healthcare provider. They can help determine if there's an underlying condition, such as pancreatic cancer, that needs to be addressed. It's important to remember that these signs can also be caused by other health conditions, not just pancreatic cancer. Pancreatic cancer is relatively rare compared to other health issues, but being aware of these symptoms can help with early detection. If you experience any of these signs, especially if they're new or worsening, it's very important to consult with your doctor. Early diagnosis can make a big difference in treatment and outcomes. Regular health checkups and being aware of changes in your body are key to staying on top of your health. If you have a family history of pancreatic cancer or other risk factors, talk to your doctor about whether you need additional screening or tests. To keep track of your symptoms, consider starting a health journal. Write down when you notice symptoms, their severity, and any other details that might be relevant. This can provide valuable information to your healthcare provider and help them make a more accurate diagnosis. Note changes in your weight, appetite, energy levels, or any other unusual symptoms. A health journal can also help you remember details that might be important for your doctor. It can be easy to forget specifics when you're discussing your health, so having a record can be very helpful. If you have concerns about pancreatic cancer, or if you're experiencing multiple symptoms from this list, don't wait to seek medical advice. Early consultation with a healthcare professional is important for effective treatment. They can perform tests such as blood tests, imaging scans, or biopsies to determine the cause of your symptoms. Even if your symptoms turn out to be related to a less serious condition, it's always better to get checked out and have peace of mind. Your health is extremely important, and taking proactive steps can help make sure you get the care you need. Your health is your most valuable asset, and staying informed about potential signs of serious conditions like pancreatic cancer can make a big difference. By paying attention to these symptoms and seeking medical advice when needed, you can improve your chances of early diagnosis and successful treatment. Have you, or someone you know, experienced any of these symptoms? Share your thoughts or experiences in the comments below. If you found this video helpful, please share it with others who might benefit from this information. Don't forget to like and subscribe for more important health content. Until next time, stay vigilant and take care of your health. Goodbye.